Sexually transmitted infections are among the modifiable factors in the causes of infertility. It is estimated that 15 million people in the U.S. acquire an STI every year. There seems to be a correlation between the age in which sexual activity began and number of sexual partners and acquiring such infections. Women who had sexual intercourse before the age of 15 were nearly 4 times as likely to report an STI than women who were older than 18 for their first sexual intercourse. This study suggests that the younger the age at initiation of sexual activity, the higher the incidence of STIs and tubal infertility. Due to the infection being asymptomatic in 70% of women, chlamydia can lead to an increase of pelvic inflammatory disease, tubal infertility, and ectopic pregnancy and HIV. According to the CDC, more than 1 million women in the United States experience an acute pelvic inflammatory disease each year, and more than 100,000 of these women become infertile as a result. Nulliparous women rated future infertility very severely. Nearly 20% felt that infertility was worse than paralysis. This suggests that young women with PID would change their behaviors if their healthcare providers would have discussed the risk of future infertility with them.
Occupational factors can also play an important role when it comes to a woman being infertile. Frequently being exposed to hazardous substances in the working environment can inhibit fertility. These substances can include but not be limited to nitrous oxide, textile dyes, lead, mercury, and cadmium. Limiting exposure to these substances can decrease its negative effects on fertility. Now that we know some of the causes, we're going to talk a little bit about management. There are various ways one can manage or treat infertility. It is ideal to initiate management with the least invasive treatment. This includes lifestyle changes such as weight loss, discontinuing smoking as well as alcohol consumption, engaging in proper nutrition, and avoiding unsafe sexual practices. There is also other options that are a little more invasive, and these include hormone therapy for those who lack or are deficient in certain hormones that are vital to fertility, and there is also IVF therapy. Throughout the various studies that were analyzed, it was found that there were many positive correlations to infertility that can be under the individual's control. The woman's surrounding and lifestyle play an immense role to her ability to conceive. Making positive changes, making the necessary changes can enhance the ability to bear a child. As healthcare providers, we have a responsibility to teach and educate women, as well as men, about the different potential contributors to infertility and bring it to their awareness. Some of these being the risk factors, such as advancing age or smoking, like the ones previously mentioned, as well as unhealthy lifestyle and sexual practices, and environmental and dietary factors.
In conclusion, with proper assessment and treatment options offered, infertility can be reversed. Women are more susceptible to making lifestyle changes if told of the negative effects their poor habits have on fertility. The condition and health of the women's reproductive system is a major area to explore. It is where conception is taking place. It is vital to ensure that it is functioning to its utmost potential. These are our references, and we have reached the conclusion to our presentation. Thank you so much.